So great, let's get started. This is Cool in Action, and the session will cover a number of different areas. I thought I'd just give a quick overview. As you can see, Queensland is an exceptionally large state. It's geographically diverse, and the population is spread throughout the state. Half the population, in fact, in Queensland lives outside of the major metropolitan area, and this is different from the other states. The access to oncological care is both public and private, and it's around about 50-50 for each. So we're dealing with a population of 516 million people. We've got 17 hospital and health services. We've got 350 different cancer settings and 66 source systems. That's an awful lot of stuff, and as you know, and you might have seen in the news, Queensland has been involved in the public sector in getting the IEMR up and running. That really only connects the major public hospitals. It doesn't connect all the public hospitals, particularly the regional and rural. And in terms of radiation oncology, there are different systems used by different centres. And in terms of medical oncology, the pharmacy information management systems are also not unique to the whole of the state. So it would make sense if we could do our best to try and get all of this data in one place and draw it in together to give some overall perspective. And that's exactly what the Queensland Oncology Online is achieving. And since 2007, with the Queensland Cancer Alliance group working closely with specialist clinicians, surgeons, care coordinators and nurse navigators, they've really delivered quite an exceptional platform that has been growing and improving over these years. Just to the left of this slide, you'll see a sort of a picture, but this picture is incredibly important for clinicians. As soon as you open up and log in with your secure login, you can just type in a patient's first name and surname. It'll bring up a number of people maybe answering to those criteria, but you can select the date of birth and immediately view a patient. That gives you access to previous cancer treatments that the patient has had, previous histology, and as a result you can have a quick overview of where your patient is from a cancer perspective. You can then refer patients onto the MDTs. You can enter your own demographic data. You can enter your own staging data. You can also refer people to cancer care coordination. So it's really a system that is incredibly well integrated and easy to use, and that's probably the most important thing. The biggest fear that clinicians have around big data is, how do you even start? As we said, it's a collaborative, co-designed platform, and it's sustainable. It's been there since 2007. The new web-based protocol is even easier to use and more accessible, and it's very patient-focused. So with a secure login, you can see that people feel and see the benefit. And so since that period of time, there's been a massive increase, certainly in public MDT access for patients, and we know that people who are presented at MDTs have better outcomes. We're hoping to see the private sector starting to improve and increase, and I think this is what COSE is all about, is making sure that people understand what's available and getting it out there.